Order. Vera Hobhouse to move the motion.
Thank you, Mr. Hollowburn, and it's a pleasure to serve with you in the chair. I beg to move that this House has considered Eating Disorder Awareness Week. Mr. Hollowburn, across the UK, 1.25 million people have an eating disorder. These include binge eating disorder, bulimia, anorexia, other specified feeding or eating disorder, and avoidant or restrictive food intake disorder. Left undiagnosed and untreated, eating disorders can be silent killers. Anorexia has the highest mortality rate of any mental illness. And results from one study have shown that a third of people with binge eating disorder are at risk of suicide. For too long, sufferers have been left feeling trapped and alone. Urgent action is needed to tackle this rising epidemic. The theme for Eating Disorder Awareness Week 2024 is Avoidant Restrictive Food Intake Disorder, or AFRID. This condition is characterized by a limited range of food intake. Sufferers may only eat safe foods and can avoid entire food types. This means they have difficulty meeting their nutritional and energy needs and can experience weight loss and health problems. AFRID can come from sensory sensitivity and fears of negative consequences from eating. Beliefs about weight and shape do not necessarily contribute. Be Body Positive, an NHS-backed psychoeducational website, have shared a story of what life can be like with this condition. Talia was diagnosed with AFRID when she was 20. She was initially misdiagnosed as a fussy eater before eventually being misdiagnosed with anorexia as a teenager as a result of a significant weight loss. Because she was misdiagnosed, she missed out on early vital treatment. In her own words, growing up, I felt misunderstood and isolated because of my eating habits. Knowing that AFRID exists has been a validating experience, connecting me with a community of people who share similar challenges. The helpline run by Beat received over 2,000 phone calls from people looking for support for AFRID last year, 2,000 only last year. However, awareness of AFRID is still very limited. Misperceptions that it is just fussy eating leave sufferers like Talia feeling alone. There is no solid data for how many people in the UK have AFRID. It could be anywhere between less than 1% of the child and adolescent population to over 15%. Because of these perceptions, accessing specialist treatment can be a lottery. There is a lack of standardized treatment pathways for AFRID, and it is hard to find out what support is available. A recent survey of NHS websites found that only 6 of the 55 NHS providers of eating disorder services for children and young people explicitly stated that they provide treatment for AFRID. Only 1 of the 49 NHS providers of adult eating disorders services said the same. 1 out of 49. Rigid stereotypes of eating disorders persist in other areas. Despite their high prevalence, eating disorders are frequently misunderstood and viewed as a lifestyle choice. Contrary to popular belief, eating disorders are most common among people with severe obesity. I have been appalled by stories of people being turned away from treatment because of their body mass index was too high and have long supported Hope Virgo's Dump the Scales campaign to change this. NICE guidelines state that single measures like BMI should not be used to determine whether someone receives treatment. However, these guidelines are not being uniformly implemented. Some services are still using these barriers due to severe mismatch between demand and capacity in chronically underfunded services. It is not uncommon for patients to get to a worryingly low BMI before they are considered appropriate for an inpatient bed. This requires investment, but eating disorder treatment is cost-effective at any stage. We know that early diagnosis is critical. The earlier someone receives intervention for their eating disorder, the more likely they are to make a full recovery. The longer symptoms are left untreated, the more difficult it is for that person to recover. Healthcare should focus on prevention before cure. Access to the right treatment and early support is life-changing. If we want to save money, prevent hospital admissions, save lives, and improve outcomes for all sufferers, we need to ensure full implementation of clinical guidance around diagnosis. There are many wonderful organizations working up and down the country to get people the help they need. I pay tribute to SWEDA, previously known as the Somerset and Wessex Eating Disorder Association. They provide invaluable support to so many families across my local area, and they are expanding their operations this year. Last year, SWEDA told me that they saw a 150% increase in people attending support and guidance appointments for eating disorders compared with pre-pandemic figures. Their children's service was overwhelmed with young people and their parents desperately seeking help. Eating disorders wipe out adolescence. Young people suffering from eating disorders miss out on so many educational and social opportunities. These years are stolen from them, and that is not to mention the potentially irreversible effect on their physical health. I welcome the access and waiting time standards already set for children and young people services. However, these targets have still not been met. 6,000 children and young people are stuck on the NHS waiting list for treatment. 2/3 of these cases have been waiting for over 3 months, despite the standards stating that routine access should start treatment within a month. Between 2022 and 2023, less than 3/4 of children's urgent cases started treatment within 1 week. This is well below the 95% standard. If we are having standards, the government must provide the resources to meet them. For adults, there are not even targets in place. Adult eating disorder services in England are severely under-resourced, especially now that demand on these services has risen to even higher level as a result of the pandemic. These services typically have either long waiting lists or strict referral criteria. This means that many adults are unable to access the treatment they need until they have become very, very ill. On average, people wait almost 3.5 years to get treatment for their eating disorder, and adults wait twice as long. Shockingly, sufferers are reaching the point of emergency hospitalization before they can access care. Delays have deadly consequences. In 2017, the Parliamentary Health and Services Ombudsman published a damning report into the failings that led to the death of 19-year-old Avril Hartz from anorexia and 2 other adults with an eating disorder. Last February, the Health Service Journal identified at least 19 adults with eating disorders whose death sparked concerns from coroners about their care. At least 15 of these were deemed avoidable and resulted in formal warnings being issued to mental health chiefs. We can never allow this to happen again. We must remember that eating disorders are treatable. Targets are crucial if we are to tackle this epidemic. An access and waiting time standard for adults would provoke significant extra funding and focus. If we want to encourage people to seek help, we need to give them a guarantee that they will be seen. Having clear standards can facilitate service improvement. They enhance the experience for patients and drive up health outcomes. Though there's still a way to go, the standards introduced for waiting times for children and young people's eating disorder services have driven some crucial service improvement. We need to see the same for adults. Our health service is simply not equipped to empower to deal with eating disorders. I was disappointed that the government decided against publishing a 10-year cross-government mental health and well-being plan for England. Instead, They developed and published a major conditions strategy that would include mental health alongside cancer, cardiovascular disease, and dementia. We need targeted and varied strategies for targeted and varied issues. I point the government again to Hope Berger's Eating Disorder Manifesto. It calls for the government to implement an evidence-based national eating disorder strategy with a plan outlining how they will tackle the huge rise of people affected by eating disorders. I would also like to see the appointment of an eating disorder prevention champion to coordinate the government response. The strategy should integrate obesity and eating disorder prevention plans, as there are so many overlapping factors between the two. The government should also look at reforming treatment approaches. For example, an Oxford University study found that using the integrated CBTE approach over the current inpatient approach reduced readmission rates for people with anorexia by 70% over a year. We should also look at the other available options. The APPG on eating disorders, which I chair, is currently running an inquiry into intensive outpatient treatment. These programs are designed to support people with severe eating disorders for whom traditional outpatient treatment is not working. Patients go home in the evening and at the weekends and have access to increased meal report and therapy. They can be treated in a familiar, community-based setting. These programs are recognized as an effective and less expensive alternative to inpatient care. And importantly, this treatment is often much more preferable to both patients and their loved ones. However, intensive outpatient treatment is not widely available across the country. There's also no up-to-date information on exactly how many services are providing it. Again, this comes back to appropriate early intervention. Universal access to intensive outpatient services could minimize the need for disruptive inpatient stays. I hope to hear comments from the Minister on investment into these treatments. Much of this comes back to the resources. The government funding that is provided needs to reach frontline services. The APPG for eating disorders found that 90% of the additional NHS funding given to clinical commissioning groups for children's services did not reach the front line. The government must ensure that its pledges for funding are not empty words and that money is getting where it is needed. A one-off boost is not enough. Soaring demand for underfunded services will leave people missing out on care when they need it most. We also need to fully understand eating disorders to tackle them. From 2015 to 2019, eating disorders accounted for just 1% of the UK's already severely limited mental health research funding. The APPG on eating disorders previously conducted an inquiry into eating disorder research funding. It found that a historic lack of investment has led to a vicious cycle of underfunding. The APPG also emphasized that we need to diversify the research agenda. Certain eating disorders and patient groups have not been served by current research. This is a real barrier to efforts to improve care. We cannot identify the obstacles without information. Some progress is being made. It has been encouraging to see some increased investment into eating disorder research and a commitment to actively involving people with lived experience into emerging research collaboration. We now need to see targeted investment and ring-fenced funding. Mr. Holloway, eating disorder sufferers are being abandoned. We are well aware that the NHS is in crisis, but while we have heard harrowing stories about ambulance and A&E delays, the impact on mental health services has received little attention. Eating disorders are an epidemic, and the sooner we realize that, the sooner we can treat them with the attention they deserve. No one should be condemned to a life of illness, nor should anyone be dying of an eating disorder in 2024. Thank you.
Question is that this House has considered Eating Disorders Awareness Week 2024. The debate can last until 4:30. I'm obliged to call the front benches no later than 3:57, and the guideline limits are 10 minutes for the SNP, 10 minutes for His Majesty's Opposition, and 10 minutes for the Minister. And then the mover of the motion will have 2 or 3 minutes to sum up the debate at the end. In the meantime, it's backbench time. Olivia Blake.
Thank you, Chair. And could I also thank the honourable members across the House and Chamber for their support in this debate. And of course, the honourable member for Bath for proposing this debate and all the work that they do on the APPG for eating disorders is really very much appreciated and rightly puts this issue repeatedly back here in front of us to discuss each and every Eating Disorder Awareness Week. And I would also like to thank the Backbench Business Committee for granting us time to debate this issue. Like many serious mental illnesses, eating disorders are often endured in silence. This means symptoms can go unnoticed, resulting in devastating consequences. Without diagnosis and treatment, eating disorders can be deadly. They have the biggest mortality rate of any mental health condition. Around 1.25 million people in the UK live with disordered eating, a number which has inevitably been made worse by the pandemic. While we know that younger women are especially at risk of suffering from eating disorders, it is vital to remember that they can and do affect all people, regardless of age, gender, ethnicity or background. So the general topic of today's debate, Eating Disorder Awareness Week, is an important one, and especially important to one of my constituents. I want to talk about someone who I've been supporting for the last 2 years now, who has shared her deeply distressing experience as an inpatient on a mental health ward. She spoke about the way in which she was reduced to numbers before receiving help. Despite not being able to eat, drink or take medication for 5 full days on the ward, and after asking for medical help, she was told she would only be referred once she had reached a specific blood pressure and blood sugar reading. During this ordeal, she was not provided any support at meal times, and eventually staff stopped asking if she wanted any food or drink. This resulted in a situation in which she was transferred to another hospital in critical condition, requiring emergency medical treatment in the ambulance on the way. As my constituent rightly told me, no one should ever be left to the point of a medical emergency before needing help. It is right that we acknowledge the hard work of eating disorder specialist NHS workers and campaigners in my constituency and across the country, like Hope Virgo, who we've already heard about, and many others. Specialist frontline workers continue to provide vital life-saving care in increasingly difficult circumstances and with increasingly scarce resources. But we also need to see much more training for all frontline staff in eating disorders so they understand how to treat patients in their care. But we know that eating disorder services are at breaking point. Demand is going up, cases are becoming more critical, training and resources are scarce, and availability of support is a postcode lottery. This means that unacceptable cases such as this are inevitably becoming more and more common. The current system is failing. As I said last year, we are facing a crisis with terrible human consequences. Chair, the specific theme of this year's Eating Disorders Awareness Week is avoidant restrictive food intake disorder. Anyone can have ARFID. It can affect children, teenagers and adults. Although it is little known and often misunderstood condition, it can have serious consequences for health if left untreated. Too often, misconceptions about picky or fussy eating trivialise this serious condition, and the stigma and fear of judgment mean that those with ARFID and their carers often suffer in silence. The charity Beats has reported an increase in calls to their helpline from people affected by ARFID. In 2018, they received 295 inquiries about the disorder. By 2023, that had ballooned to 2,054 calls. Yes, I'll have to give that.
Does she agree? It is also worth mentioning, it is about the carers and caregivers and the parents who need to know about this condition, and because they are often worried to death when they see a child or a young adolescent in this condition and they do not know what to do.
No, and absolutely, I do agree with that, and I've certainly had carers contact me to ask for where they can find guidance on this because of the limits locally, which I'll go on to in a bit. But absolutely, that's probably why we've seen these increasing calls for support for carers. And I think, certainly carers are hearing time and time again that people are struggling to get the help that they desperately need, and that's really partly due to a limited awareness, limited research on the condition and a lack of standardised treatment pathways. Today's debate plays an important role in tackling the misconceptions that we have seen in the system and raising awareness of this serious condition that can have fatal consequences if left untreated due to malnutrition and other issues. But another part of the problem is under-resourcing in the system. Since 2011, hospital admissions for eating disorders have nearly doubled in England, going from 2,287 to 4,462 last year, after peaking at 5,559 cases in the year 2021 to 2022. Currently, 12.5% of 17 to 19-year-olds are estimated to suffer from disordered eating. Shockingly, an NHS England survey found that 59.4% of 17 to 19-year-olds exhibited behaviours that suggested it was possible they had an eating disorder. Amongst girls, that rises just over 3/4 at 77%. While ministers have promised more funding, the scale of response simply isn't matching the alarming level of demand. Consistently, the waiting time targets for specialist eating disorder services for children and young people, whilst recently put in place, have not been met, while the lists have simply been growing longer and longer. As a bare minimum, there should also be an action plan for addressing that backlog, and a similar target must be put in place for adults seeking help, which was a previous plan, which has clearly been dropped in the major conditions strategy that was mentioned by my colleague earlier. Without a clear plan in place for meeting those targets, it's also really important that we make sure that the care is available to people. All children and adults with an eating disorder should be able to get the access to the care that they need, and it's not good enough addressing the inpatient figures alone. We know that early intervention is the right treatment. The devastating consequences of eating disorders can be prevented, yet the government has done very little to move us in the right direction towards preventative care. Due to the delays in identification, referral, waiting times, those able to access treatment are waiting on average 3.5 years between onset and start of treatment. That is far too long when we know that the earlier we get to people, the better their chances. The delay is potentially fatal for many, with recovery being far more likely for patients who receive medical intervention early, when behaviour can be adapted before it becomes too ingrained. For ARFID specifically, we need an NHS-commissioned treatment pathway and trained NHS staff so people do not go undiagnosed or untreated or in treatment pathways which are not suitable for their needs. It's now 7 years since that Parliamentary and Health Service Ombudsman report that my colleague mentioned, and that report was damning, in which they concluded that patients are being failed by the NHS eating disorder services. It is shameful that we can't point to more progress made in this area, and that since then the Ombudsman has felt the need to reiterate the report to try and get more action in this space. This crisis should be an opportunity to rethink our approach to how we support and treat people in the UK who suffer from an eating disorder. I therefore urge the Minister to look at the transformative work of groups such as SAIDA locally, South Yorkshire Eating Disorder Association, are doing to help build an alternative framework for care nationally. It's time we acknowledge the crisis and commit the training and resources necessary to fix it.
Hollowburn. Excuse me. Can I congratulate the Honourable Member for Bath for not just for securing this debate, but her dogged pursuit of this issue over the years, and it's one of the Minister should be aware it's one of the most active and actually really effective all-party groups that we've got in Parliament as a result of the work that she's done, and she's collected around people, honourable members like the honourable member for Sheffield Hallam, who have been extremely committed in representing their constituents. We all come to this, I think, as a result of the experience of dealing with constituents in that way and the hardships that they've faced. I want to make a limited number of points, but I also want to thank Hope Virgo for the work that she's done in terms of the campaign, the book that she's written, And again, if it wasn't for her, I don't think we'd be on the agenda in the same way we have been so effectively in recent years. I want to thank the government as well, because the government early on did recognise there was an issue here and did bring forward some resources as well. So I'm grateful for the government doing that. But this is one of those issues that the more you get into it, but also I think things are moving on so rapidly in the scale of the problem, we will have to come back to the government on a regular basis to look at how we top up those resources. Much has been mentioned about the stats today, the statistics today. I heard 1.25 million, others have said 1.6 million, but it seems like a bottomless pit at the moment. The health survey I thought was really interesting that came out of it. It was, if I remember right, the screening that took place that said that they were looking at the positive, those that proved positive for the potential of an eating disorder. So they're trying to get ahead of the numbers, really. And that said there was 16% of the population could be at risk in the current situation. 19% women and 13% men. And one of the issues that I think the APPG have been really good at breaking through is that this isn't just about women. There's a large number of men who are involved in this problem as well that need to be addressed. What we've discussed in all these debates really is trying to get across the impact, and to a certain extent it's trying to acknowledge to our constituents that we understand the impact on their lives as well. What I'm coming across now is, of course, the mental health issues are fundamental. We've had suicides, we've had deaths, but we've also had quite an outbreak of self-harm as well amongst people who are suffering from this condition. But then also people have reported the impact upon their ability to work, meet socially and engage in a full life. And what worried me most was, as I've looked at over recent years, the huge increase in terms of the numbers being admitted to hospital now. I think the figure is about 4 times the increase in recent years as a result. And as has been said, this is the mental health condition with the highest mortality rate. Part of that, I have to say, is because this mismatch between the scale of the problem and the resources that are available. And that includes the number of in-house beds, in-hospital beds. My understanding at the moment, there are only 450 specialist beds, but we're talking of an admission rate of around about 20,000. So it's a startling difference between what's needed and what's been provided. Certainly.
Does he not agree that the biggest problem is that for too long it's been seen as a lifestyle choice rather than that it is an illness, and we still need to break through with that?
I think that thanks to the work the Honourable Lady has done and others have done and the campaigners have done, I think to a certain extent the media reporting of this issue has changed dramatically, but that's taken years to achieve. But it's still an issue that I agree. It is still seen as a lifestyle choice, but also it's not seen as serious. People don't relate deaths to this condition, whereas we all know if we've dealt with constituents, that's what happens. The other issue about the access to hospitals and clinics is that all of us really have dealt with constituents where we've had to map out across the country where they can go. And often what will happen is they'll be discharged from one unit and then it's almost impossible to get them into another, particularly for their specialist concerns that they have. The issues that we're reiterating today is funding does need reviewing again because it's moved on since we last discussed funding with the government. The second thing, there is a lack of clarity about having a very concrete action plan for the coming period. And one of the issues there, I think, is about how we bring people together. There's a real concern about the lack of monitoring. And one of the proposals, I think Hope Virgo first put it up, was that there does need to be a real discussion now about how we're monitoring the situation, both in terms of incidents, but also in terms of treatments and the effectiveness of different treatments. And one of the proposals in one of the discussions that we had is it is time now to bring together again those with experience of the condition and the key clinicians that are working in this field. just to stand back objectively and look again at where we're at. Do you know, when we've had situations with regard to homicide or suicide in other fields, we've actually set up independent inquiries because of the seriousness of the matter. In some instances, it almost feel we need some form of inquiry to see where we're at and what's needed in the future. Can I also say, my honourable friend for Bath mentioned and my honourable friend for Sheffield Hallam mentioned the staff. The impression I get from the discussions that I have is there, because of the increasing level of demand, there's a level of almost exhaustion among staff, and there's a morale issue about being able to just cope with the numbers and the severity of the conditions that they're dealing with at the moment. I think one of the things we can do today, as others have done, acknowledge the commitment and dedication of those staff, but recognise they do need greater support, both in terms of numbers, and I have to say also in terms of pay too, to demonstrate just how valued they are. The issue around the NICE guidelines has already been raised, but my experience is the same as others, really. It's hit or miss. There's a postcode lottery about how that treatment, how those guidelines are going to be provided. The Dump the Scales campaign by Hope Virgo and others, I think, has been effective in moving the debate on, so it's not just about BMI anymore, and there's a wider range of discussions taking place, which I really welcome. But this still isn't a recognition just across, I think, services that this is a mental health issue, and therefore there's a need for mental health practices that have been effective elsewhere to be applied here. And I do want to argue very strongly about the need for funding with regard to cognitive behaviour therapy. As has been said, I think the figure was 70% was the success rate in terms of positive outcomes. But the other issue there was they've reduced readmission rates, I think now down to about 15%. So this is a huge saviour of money for the NHS as a result of that. And again, what we need to do there is look exactly at just what's the levels of investment, both in terms of the training of staff for that and then also ensuring access itself. Can I raise one other issue that we've raised before as well? We found too many examples of the provision of palliative care to sufferers, and we're hoping that will be ended. Palliative care should only be offered if there's another life-threatening condition. It shouldn't be offered just because of this condition. We're hoping that's been ended now, but it needs monitoring again to ensure that the message has got out there. Our view, I think, overall, is that with the right support, early enough intervention, people's lives can be saved and their lives can be transformed as a result. But it does need adequate funding. My honourable friend has mentioned the ring-fenced fund that's needed for research, but also I think it is, at this stage now, it is time to stand back, bring sufferers and clinicians together, look at what the strategy should be, and then have a concrete strategy that we can all sign up to that's adequately funded. A lot of this is a cross-party issue. It's not a party political thing they're arguing for. And as I say, I welcome what the government has done so far, but I think we're in the stage now where we know so much more about the escalation of this problem and the need for the therapeutic interventions. And in addition to that, I think we know so much more about what works and what doesn't work. Final point to me, like others, I just want to pay tribute. I want to pay tribute to all those campaigners that have put this on the agenda and supported us throughout. I want to pay tribute to all the clinicians, of course. I want to pay tribute to one group where we held one session, if people can recall, which is the school nurses, and they brought forward their programme and how they would provide advice and assistance to pupils as well, which proved to be incredibly effective. And of course, I want to pay tribute to all those who have supported my honourable friend's all-party group with such expert advice. But in addition to that, consistent nagging as well.
We now come to the front bench speeches, the first of which will be Patricia Gibson for the SNP.
Thank you, Mr Chair, and I wish to begin, as others have, by congratulating the Honourable Member for Bath for bringing this debate forward once again in Eating Disorders Awareness Week, and I'm very glad to once again participate in that debate as I have done in the past. And in previous years, when I've participated in this debate, I always begin by pointing out that I first became aware of this condition, eating disorder conditions, in the 1980s when Karen Carpenter died. And then in 1999, again when Lena Zavaroni died. Both women had struggled with eating disorders for a number of years and sadly succumbed to them when they ought to have had so many years ahead of them. Similarly, we have an estimated 1.25 million people across the UK in a similar struggle. Eating disorders, as we've heard, are no respecters of age, ethnicity, gender or background. Indeed, a quarter of those with eating disorders are men. The mortality rate is high, especially for those with anorexia, which has the highest mortality rate of any mental illness, and with 1 in 6 people with binge eating disorder attempting to end their lives. Other mental health challenges can often accompany eating disorders, such as depression, self-harm, anxiety, and obsessive behaviours. Because eating is fundamental to survival, those with eating disorders typically develop severe physical health problems. But we know that with the right support and treatment, we can change lives, and early intervention provides the best chance for recovery. Eating Disorder Awareness Week this year seeks to highlight avoidant restrictive food intake disorder, or ARFID, a relatively new term. And this is different from other restrictive eating disorders in that it describes a pattern of eating that avoids certain foods or food groups entirely and/or is restricted in quantity. Sometimes those with it eat very, very small amounts. Avoidant and restrictive eating is not related to a lack of available food or cultural norms or even fasting for religious reasons. And it's not related to a person's view of their body shape, and it's not related to a specific purpose, such as losing weight. And it doesn't feature some of the other behaviours that can be associated with anorexia, bulimia, such as over-exercising. ARFID is often dismissed as picky eating, but the crucial difference between what we might call a picky eater and a child with ARFID is that a picky eater won't starve themselves to death. A child with ARFID very well might. Whilst the exact causes of ARFID are unknown, it is thought that people who develop it do so because of sensory sensitivity, fear of negative consequences, or a lack of interest in eating. For example, they might be very sensitive to the taste, texture, or appearance of certain types of food, or have had a distressing experience with food, such as choking, vomiting, infant acid reflux, or other gastrointestinal conditions. And this may cause the person to develop feelings of fear and anxiety around food, leading them to avoid it. And it doesn't discriminate. It can affect anyone of any age, including even babies, and can be diagnosed in children as young as 3 years old. Now, researchers know much less about what puts someone at risk of developing ARFID, but it's been discovered that people with autism spectrum conditions are much more likely to develop this condition, as are those with ADHD and intellectual disabilities. In addition, children who don't outgrow what we might call normal picky eating, or in whom picky eating is severe, appear to be more likely to develop ARFID. And many children with ARFID also have a co-occurring anxiety disorder, and they're also at high risk for other psychiatric disorders. According to BEAT, the UK's largest eating disorder charity, there has been a 7-fold increase in calls to their helpline related specifically to ARFID over the past 5 years. The variable service provision for this condition is partly due to the lack of research into treatment for it. The Scottish Government has provided BEAT with over £600,000 to provide a range of support for those impacted by an eating disorder, but performance still varies across health boards. There must be no complacency about that, and to help tackle this, a consultation was undertaken on the draft national specification for the care and treatment of eating disorders in Scotland to ensure that support and services meet the needs of those living with an eating disorder, wherever and whoever they are in Scotland. The responses to this consultation will be considered carefully. But when a person has an eating disorder of any kind, they need compassionate support with their mental and physical health. But their loved ones also need support, because this is a condition which impacts whole families, not just individuals. Indeed, it is close loved ones who are the first to pick up on the fact, very often, that their beloved family member has an eating disorder. And there's nothing worse than watching a loved one's mental and physical health deteriorate before their eyes from a condition which is often not well understood and, sadly, not always supported sufficiently either through prompt and sensitive treatment. I'm very glad that we are having this important debate once again in Eating Disorder Awareness Week into this condition, and taking the opportunity to raise awareness of eating disorders in general, and this year of avoidant restrictive food intake disorder, into which we need much more research, and which I have to confess, Mr Chair, I knew almost nothing about before I started looking into it in preparation for this debate. But I hope debates like this will help those who are living with an eating disorder and their loved ones to feel less alone, because it can be a very isolating illness for individuals and their families, which can only compound the pain and fear that this condition very often generates.
It's a pleasure to serve with you in this chair. I want to start by my remarks by praising my friends, the Honourable Member for Bath and Honourable Member for Sheffield. They are both true champions in this particular area when it comes to suffering and eating disorders and all those with mental health issues, especially our children and young people. So I want to congratulate them on securing this debate and for their excellent contributions. I also want to congratulate them for their continued work on this issue through the Eating Disorders APPG, for helping to champion this issue. I would say they've really brought this issue on the national radar, and particularly trying to do this effectively cross-party to eradicate the epidemic of eating disorders. I'd also like to thank my honourable member for Hayes and Harleton, who talked passionately about the impact this is having on individuals and highlighted the fact that we need to understand the impact this is having on people's lives, which could occur through, whether it's through work and life, and also talked about the fact that there's been a huge spike in figures when it comes to hospitals. I also wanted to touch on some of the points mentioned by the Honourable Member for Bath, who used really powerful statistics that hit home the growing problem of eating disorders, and also highlighted the disparities across the where it's been taken high up on the agenda in certain areas, which isn't always the case. And also talked about the importance of carers and parents need to know more about this condition so they could help address this. And this was also echoed by my honourable friend for Sheffield and Hallam, who talked really passionately about her constituent who said he was reduced to numbers instead of reaching help, and highlighted something that really kind of hit home with me, that where her constituent said no one should be left to medical emergency before needing help, and that there should be standardised treatment when it comes to this particular matter. I'm pleased to speak today on behalf of the opposition to mark Eating Disorder Awareness Week, and as many people in this room will be aware, eating disorders have serious mental health, mental illnesses that can also have severe consequences. It is estimated that over 1 million people in the UK are living with an eating disorder, and the reality is that far too long those suffering have been ignored. Eating disorders are responsible for more loss of life than any other mental health condition. That's already been echoed, and unfortunately, as we've seen with the statistics that have been raised in this debate, it's increasingly becoming quite common. So the sooner someone receives treatment, the better their chances for making a full and sustained recovery, yet this isn't often the case. It is a credit to the many campaigners and also parliamentary colleagues in this room who have been working on this, along with vital charities such as BEAT, that we can say that progress has been made in awareness and support. However, as we continue to face the severe consequences of the pandemic, we see a mental health crisis across our country. We all know that so much more urgently needs to be done. The figures from the NHS suggest that the proportion of aged 17 to 19 with eating disorder stands at 12%, and that is just up from 0.8% 6 years ago. Hospital admissions are double the levels of a decade ago, and last year the Awareness Week focused on the specific challenges to men. So I also want to quickly echo my honourable friend for Sheffield, who also mentioned in this debate, along with other members, that it's important that we recognise that eating disorders do not discriminate. They affect any age, ethnicity, gender or socio-economic background. So it is important to highlight these facts when continuing to break down the stigmas and stereotypes to prevent too many from reaching out and receiving the much needed help they need. This year, BEAT have focused their attention on another important issue that has often been overlooked, so avoidant restrictive food intake disorder. That can affect anyone of any age, and BEAT have estimated that the number of people with this disorder in the UK could be over 200,000, and that can be very difficult to diagnose. And as BEAT have highlighted, that it can also be very limited information for those seeking help, which echoes the fact that's been mentioned by honourable members today about parents and carers not having the sufficient information to be able to look at how they could address these issues. So, for example, it's been highlighted 8 in 10 eating disorder service providers did not state on their website whether or not they offered the avoidant restrictive food intake disorder care. The data clearly shows that cases of this nature, like all eating disorders, have surged in recent years across the UK. However, as cases have been rising, services have struggled to match the demand. This means more and more waiting and anguish for longer. In 2015, the government introduced a new waiting times access standard for community-based eating disorder services for children and young people. This included targets for 1 week urgent treatment and 4 week routine treatment. Yet these targets have not been met. In fact, they've never been met. So I'd be grateful if the Minister could, in his closing, essentially say what would be done to address this, because it's much needed in terms of meeting those targets. Also, instead of meeting those targets last year, 1 in 5 patients with non-urgent referrals were not seen within 4 weeks, and 1 in 3 patients with urgent referrals were not seen within a week. When children and young people with urgent cases of eating disorders are found to be waiting more than 12 weeks to start treatment, the severity of the current crisis cannot be overlooked. I also want to raise the important issue of providing adequate care to adults. As highlighted by the HSG report last year, the deaths of 19 eating disorder patients, with at least 15 of those being deemed avoidable, demonstrated an urgent need to improve eating disorder provision. I hope to hear from the Minister today about what more the government is doing to address those concerns and make sure all those patients receive the quality of care they deserve. I also wanted to touch on some of the points mentioned by the Honourable Member for Hayes and Harlington and the Honourable Member for Bath and Sheffield, where they had mentioned about the lack of monitoring and the lack of effectiveness, monitoring in terms of effectiveness of treatment being provided. I wanted to see if the Minister was aware that the Royal College of Psychiatrists have published guidance to provide support in terms of to healthcare professionals to develop specialist skills and knowledge to assess and treat people with eating disorders, and really to hear from the government what they're doing to ensure that this guidance is embedded in primary care and emergency departments. The opposition recognises that when it comes to eating disorders and all mental health issues, prevention is so important, and early prevention provides the best chance for recovery. Yet too many, especially our children and young people, are stuck on mental health waiting lists for months or years instead of receiving the urgent care they need. Mr. Hollowborn, we face a mental health crisis in this country, and we must have a government that acknowledges this and takes urgent action. And that's why Labour have committed to Child Health Action Plan with a bold ambition for this to be the healthiest generation of children ever. And we will recruit thousands more mental health staff to cut waiting lists and ensure more people can access the treatment. And we'll focus on prevention, on early diagnosis, early intervention and timely treatment near where you live. To do this, we will put an open access mental health hub for children and young people in every community, and will place a mental health specialist in every school. And this will be paid for by abolishing tax loopholes for private equity fund managers and tax breaks for private schools. We just can't continue to lurch from crisis to crisis, which is what is currently happening. So we must look at how we can build a new, solid, long-term foundation for a resilient health and care system with an NHS that's truly fit for the future. Thank you, Chair.
Thank you, Mr. Hollowborn, and it's a pleasure to see you in the chair. I would like to start by paying tribute to the Honourable Member for Bath for bringing forward an important debate on an important topic. I know that both as an MP and as the chair of the All-Party Parliamentary Group, she has been a long champion for those living with eating disorders, working with the Honourable Member for Sheffield Hallam and others on the APPG. Has really ensured that eating disorders are kept high on the political agenda. I share the Honourable and Right Honourable Members' passion for this issue, all those who have spoken today. As the Right Honourable Member for Hayes and Harlington said, one thing that unites everybody in the chamber today is that we've all tried to help a constituent or the family of a constituent who is suffering from an eating disorder. And I certainly have, in my 13 years as the MP for Pendle, and those cases that I've dealt with are some of the most difficult and emotional cases that have come across my desk in my surgery. Improving eating disorders services is a key priority for the government and a vital part of our work to improve mental health services. As we've heard, this week is National Eating Disorder Awareness Week, and raising awareness is essential in making progress on this important issue. I am grateful for the work of BEAT and other charities and across the whole sector who have shone a light on eating disorders and support people who are struggling. Mr. Hollowborn, we know that having an eating disorder can so often be utterly devastating for those with the condition as well as those around them. And as has been said by, I think, pretty much every member who spoke today, we know that eating disorders can affect people of any age, any gender, ethnicity or background. However, we do know that recovery is possible and access to the right treatment and support can be life-changing. Early intervention is vital, and we want to ensure that children and young people with eating disorders get swift access to support. Since 2016, investment in children and young people's community eating disorder services has risen every year, with £53 million per year from 2021-2022, rising to £54 million in 2023-24. As part of the £500 million COVID-19 recovery, our mental health recovery action plan, we invested an extra £79 million to significantly expand young people's mental health services. This includes allowing 2,000 more children and young people to access eating disorder services. We've also introduced a wait time standard for children and young people with eating disorders. Our aim is for 95% of children to receive treatment within 1 week for urgent cases and 4 weeks for routine cases. Certainly.
I'd like to thank the Minister for giving way and also responding on this. I just wanted to touch on the points about the waiting, which is down to 1 week. Those targets were implemented in 2015, which have yet to be met. And I just wanted to find out from the Minister if what work's being done on that, because you've just mentioned those same targets again. Thanks.
So I completely recognise the Shadow Minister's challenge on this, and I completely recognise the concern. I'm going to hopefully go on to set out what we're doing there. I think it's worth putting on record. She also mentioned in her remarks the Royal College of Psychiatrists, and they did a report today on this, which we very much welcome, and we look forward to working with them and other stakeholders. Waits are not as short as we would like, and the government is determined to meet our waiting time standards for children and young people with eating disorders. There is extra investment going into the services to meet increased demands and reduce waits. So hopefully we will start to see progress made towards meeting those targets. But we acknowledge that whilst there has been record investment and progress in improving access to eating disorder services and improving quality, we know that there's also been a significant increase in demand for eating disorder services over the past few years. This is especially true during the pandemic, outstripping the planned growth in capacity. Children and young people's eating disorder services are treating 47% more children and young people than before the pandemic, with almost 12,000 children and young people starting routine or urgent treatment in 2022-23, compared to just over 8,000 in 2019-20. This surge in demand has made meeting our waiting time targets more challenging, and waits are not as short as we would like them to be. However, I'm proud that our services and clinicians, backed by new funding, are supporting more children and young people than ever before. These services are changing and saving lives. We also know even earlier intervention is critical to prevent eating disorders from developing. Community-based early mental health and wellbeing support hubs for children and young people aged 11 to 25 can play a key role in providing this support. We announced in October 2023 that 4.92 million from the Treasury's Shared Outcomes Fund will be available to support hubs and an evaluation to build the evidence base underpinning these services.
Perhaps comment on what I said about the intensive outpatient units, and that we really don't have any information how widely spread they are and where they're being provided. They are a very good alternative way of treatment, and we really need more information about where they are available.
We do need more information on that, and I was going to turn to that point. I think the next point I wanted to make was an announcement which I know the Honourable Lady will already be aware of, but she will be aware, but other Honourable members may not be, that following evaluation of some excellent commercial tenders from hubs across the country, the Government announced just this week that we are now providing additional £3 million, which means a total of 24 hubs will receive a share of almost £8 million in 2024-25. This is more than double our original target of funding 10 hubs, and organisations across the length of England, from Gateshead to Truro, will now be benefiting. So I appreciate there is still a bit of a postcode lottery as you go around the country, but we are looking to strengthen services, working with different partners across England to ensure that we are improving services, either enhancing existing services or developing new services where there haven't been services provided in the past.
In terms of hubs, just wanted to find out what work would be done to make sure that data is captured to see how eating disorders, the growing problem, could be improved, and to see what effective treatments could be given to kind of slow this from increasing.
So we're working very closely with NHS England and partners to ensure that data is captured, we're also working with the charities involved in this sector and others. I know that my honourable friend, the Minister for Mental Health, has been doing a lot of work on this and has met with various stakeholders. I perhaps should have said at the start of the debate, the reason why she's not here and you have me instead is, of course, International Women's Day debate in the Chamber was still going at the point when this debate started, so unfortunately there was an unavoidable clash. But I know this is a topic very close to our heart, and things like data and ensuring that we get the data right is really important for us to be able to ensure that the gaps in the services that currently exist are being addressed. So I will certainly ensure that the Shadow Minister's issue is raised with my ministerial colleague, and I ask her to write to you on that point, if I may. We also know that eating disorders can have a devastating effect on adults too. Under the NHS long-term plan by 2023-24, we're investing almost £1 billion extra in community mental health care for adults with severe mental illness, including eating disorders. This extra funding will help enhance the capacity of new or improved community eating disorder teams covering the whole of the country. And as part of funding provided in 2021-22, in response to pressures created by the pandemic, we also provided £58 million to support the expansion of community mental health services for adults, including eating disorders. Many honourable members in their contributions today raised avoidant restrictive food intake disorder, ARFID. And I share their ambition to improve support for people living with this under-recognised condition. In 2019-20, NHS England funded 7 community eating disorder teams, 1 in each region of England, for children and young people in a pilot programme to improve access, assessment and treatment for children presenting with ARFID. The pilots ran from September 2019 to March 2020 and included training to support the adaptation of each service's existing care pathways, assessments and treatment interventions for children and young people with ARFID. The training from these pilots is now available for local areas to commission for their community children and young people's eating disorder services. In 2021, NHS England also commissioned ARFID training for staff delivering treatment in inpatient children and young people's mental health services. We recognise that there is more that needs to be done. We know that the earlier treatment is provided, the greater the chance of recovery. NHS England continues to work with eating disorder services and local commissioners to improve access to treatment for all children and young people with a suspected eating disorder, including those presenting with ARFID. Several honourable and right honourable members raised the issue of BMI and the Dump the Scales campaign. NHS England continues to emphasise to systems and services that BMI should not be used as a single measure to determine access to treatment within adult or children and young people's eating disorder services. This is in line with NICE recommendations and is included in the national published guidance as well as in the recently in the Community Mental Health Framework. NHS England are also in the process of updating the Children and Young Persons Guidance, which will also reference that BMI should not be used as a single measure. The Honourable Member for Bath asked if we would consider appointing an eating disorder champion. An eating disorder champion could, of course, help galvanise action for and support for people living with these conditions. As she may know, at the moment, at the current time, the Government have no plans to appoint a specific champion role, but I can assure her that the Department for Health and Social Care and NHS England already work closely with stakeholders who advocate for better care, such as BEAT. We're also very grateful for the work of Dr. Alex George in his role as the Government's ambassador for children and young people's mental health, which includes championing the needs of those with eating disorders. The Right Honourable Member for Hayes and Harlington raised palliative care pathways, and I want to assure him and other members that people with eating disorders should not be routinely placed on palliative care pathways, including people with severe, complex or enduring eating disorders. The NHS is very clear that all those with severe, complex or enduring eating disorders should have access to evidence-based treatments focused on helping people recover, including hospital-based care if appropriate. Staff involved in the care of people with complex and severe eating disorders must adhere to the legal frameworks that safeguarding their best interests, and NHS England will work with patient groups and stakeholders to develop further guidance on this. The member for Bath and the member for North Ayrshire and Arran also raised the issue of suicide. It is absolutely critical that we all do all we can for those affected by eating disorders before they reach this point. That's why the government published a suicide prevention strategy in September last year, which aims to reduce suicide over the next 5 years. And I'd like to reassure honourable and right honourable members that people in contact with mental health services, including those with eating disorders, are a priority group for this strategy. Mr Hollowbone, in closing, I would like to extend my thanks once again to the Honourable Member for Bath for securing this debate, and all the Honourable and Right Honourable members here today for their thoughtful contributions and questions. Thank you.
Mr. Hollowbone. I want to thank everybody who took part in today's debate on Eating Disorder Awareness Week, and I think it was an opportunity for all of us to learn more about IAFRID, or Avoidance Restrictive Food Intake Disorder. It's a long and difficult work, but it is a condition that is very severe. It is important that we understand more about it. It affects now many young people and their families. And therefore, I'm very glad that we chose this particular theme for this year's Eating Disorder Awareness Week. We have heard, but also about the many different forms that eating disorders take, and many aspects of those different forms of eating disorders are still not entirely known, including IAFRID, and we do need a lot more research into the condition. But most of all, we must increase awareness of support for sufferers and caregivers, increase urgently the access to services, and especially provide access in a timely manner. We have heard several times that we have targets for children and young people, but the targets are then not being met. We certainly need our targets for adult services. While we have made progress, Mr. Hollowbone, there is still very much more to do. I want to thank BEAT and the many other eating disorder charities and those working in eating disorder services for their sterling work they're doing. They're all doing amazing work. Last but not least, I want to pay tribute to the indefatigable Hope Virgo. Without her tireless campaigning, we would not be here today. But there is still a lot to do. I know the government is listening, and I hope very much and look forward to further cooperation. Thank you.
The question is that this House has considered Eating Disorders Awareness Week 2024. As many as of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Order, order. The sitting stands adjourned.
The proceeding has ended. 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 The proceeding has ended.